Dear parents, students, faculty members, dignitaries present on this e-platform, we all have gathered here to attend a webinar on now and next psychosocial and medical aspects of COVID-19. We all know that the outbreak of COVID-19 has affected millions of people worldwide, both physically and mentally. We all are experiencing a complete transformation in our lives from our daily affairs to professional front. The way we react to or respond to circumstances and situations tells a lot about our mental health and affects our physical health to a great extent. It is very important to be cognizant of stress management techniques which will help us in keeping good mental health, and it is even more important to be aware of physical symptoms, precautions, and effective measures to lead healthy lifestyle. We are glad to share with you that KCW Counseling Cell has joined hands with the Department of Computer Science to organize a webinar of everyone's concern. Our worthy principal, ma'am, has not been able to join us due to some important work. She has sent us good wishes that I would like to read here. Good evening, all. Everything that happens in our life benefits us in some way or the other. There are several hidden lessons learned from COVID-19 pandemic. A feeling of oneness, world is one. Let us bring our inner world into harmony and accept ourselves as we are. Your small efforts can lead to giant results. This shall propel the power of positive thinking, which shall empower us and direct us to adapt the variable shades of new normal ways of life. Keeping in view the outline of now and next, I wish to share the concept of distancing. May you be guided along a path of never-ending growth and learning. Now we should follow social distancing, and next is screen distancing. Alert and balance yourself to maintain your charismatic charm. May you command this balance to enjoy the sigmoid curve of life. Go natural and feel the bounties of nature. Nature's blessings shall sail the ship of the life to the shores of success and smile. Wishing you all a blissful time ahead. Stay blessed. Thank you all. So this was her message. We thank her for her all-time available support and guidance. She continues to be a guiding light for all of us. Today we have amongst us two distinguished guests whose expertise and experience will help us in dealing with the troublesome days of COVID-19. It gives me immense pleasure to introduce the first guest of the day, Dr. Pankaj Kumar, consultant psychiatrist, DMC Hospital, who has earned many coveted honors in the field of psychiatry. He is member of Indian Psychiatry Society and associate member of Indian Association of Social Psychiatry and Private Psychiatry. He has also been sharing his knowledge on varied platforms, like he has been actively involved in international clinical trials. Sir, we accord a warm welcome to you and look forward to your deliberation. It is indeed our honor to have you here.
Thank you.
I extend a heartiest welcome to another dynamic personality whose wide range of experience as a physician will give us clarifications on medical aspects of COVID-19. Let us welcome Dr. Tarun Satija, Senior Consultant Physician. He has the privilege of being a governing body member of IACM. He has to his credit numerous awards and honors in the field of medical science, like he has been awardee of prestigious Rotary Exchange Program for Italy and Sicily. He has been contributing immensely on lifestyle management and health education for masses. Sir, we are fortunate to have your gracious presence on this e-platform, and we are all set to gain maximum from your experience and expertise. A very warm welcome to dear parents who have spared their valuable time to be with us. I also welcome dear students to this knowledge enhancing session. I would request students to fill their attendance form by clicking on the link in the chat box towards the end of the session. Kindly note that the link will be visible in the chat box before the session ends. Without much delay, now I hand over the session to Dr. Aditi Satija from the Department of Psychology, KCW, for further proceedings. Thank you, one and all.
Thank you, ma'am. Good evening, everyone. As we know, we are not only fighting a pandemic caused by coronavirus, we are also fighting a war with our fears, our lifestyles, our fallacies. But don't worry, help is at hand. We have two luminaries from the health sector to enlighten you and enable you so that you are your own warrior. We have tried to make this an interactive session and we are flooded with queries. So, Dr. Tarun, I begin with a basic apprehension on everyone's mind. What is this COVID-19 that everyone is worried about, and how does it spread?
Well, thank you for inviting me to this session. Well, COVID-19 is a viral infection and it is spread by a virus called coronavirus. And it has believed to be originated in China and is causing a lot of problems all over the world, as all of us know. And it is basically presents with the cough, fever, body ache, headache. It may present with diarrhea and whole lot of symptoms we are still coming to know as we come to know more of the disease.
So, I would just like to ask you that all this panic, is it justified? Is it required for our survival? Like, are we doomed? Are we all going to die?
No, I think yes, the panic is there definitely because there are large numbers everywhere in the world. But definitely we don't need to panic. We have to be careful that we don't get this disease, and it is very easy to prevent this disease, as we know, and we are not going to die definitely. See, majority of us will be okay even if we get this disease. It is estimated 80% will have no problems, and many of us will be asymptomatic. So it's only a very few percentage of people who will get problems, and those are people who are very elderly or have significant medical problems. And I believe this session is being attended by younger generation, so probably all of you should be safe and we should be happy after the epidemic ends.
That is very reassuring. Dr. Pankaj, while some apprehension is justified, but as a psychiatrist and a mental health expert, is COVID-19 causing this panic in the population?
Okay. Thank you very much, ma'am. It's a privilege to be with you all the time. And doing this webinar is my first on this behalf of the general population. Will it be very clear that this is a virus and it is inactive if it's outside the cell? So our fear is the same if it is outside our body or mind. If it comes or penetrate our cell and then being activated and producing the certain symptoms, then it definitely lead towards. So the fear comes when we think about this something is endangers us, something is there is endangerous to our kids, to our dear ones. And apprehensions genuinely settle on us because out of this fear, most of the people are wearing masks in this whole population, in a large populations, and the population which are distinguished to not bothering about the government's rule. Still, they are wearing. So that is one good point of this fear. But on the contrary, with these fears, there are many of the things which psychologically, immunologically, is being lower to have a prone these infections. So we should not be worried about the why this fear. It's not fear. It's just an episode or a pandemic, which we deal with proper interventioners and psychological.
Thank you, sir. So this is very clear that we are fighting COVID at two levels, physical and mental. So Dr. Tarun, now is COVID-19 affecting the physical health of non-affected or the non-infected people, and how is it doing so?
Yeah, that's a very interesting question. Like my friend Dr. Pankaj just mentioned, there are a lot of psychological aspects, a lot of stress. I, as a physician, I'm seeing people who are not affected. They are affected quite a bit in their physical illnesses. One, I've noticed their blood pressure levels. People are very worried and they are not following their exercise routines. They are not eating properly. And as a result, I find blood pressure levels of people who are hypertensive have gone haywire. The blood sugars have gone haywire. Sleep patterns have gone haywire. And ultimately, this is going to cause a lot of problems in long run if we don't manage to take care of it now.
So now that the lockdown is being lifted, how can we prevent ourselves from getting infected?
See, I think most of us already know what to do because we have had avalanche of information coming in from TV, newspapers. But just to tell you in brief, there are three or four things we should do. First, it's very important to maintain social distancing. And by that, we should remain at least 6 feet away from any person. Take every person you meet as a potentially infected person. So even except your family members, if you meet anyone outside, please stay 6 feet away. That's the best thing you can do. Second is you should do proper hand washing with either sanitizer or with soap and water for 20 seconds. And third thing is you should have proper respiratory etiquettes. That is, if you have cough and cold, then you should stay at home. And if you cough and sneeze in public, then you should use a tissue or cough. See, we've been always told cough like this. No, that's not the right way. You should cough in your elbow so that you don't dirty your hands and then you don't spread the infection somewhere else. And third thing, very important now, is to wear a mask. And this mask is not only for your protection, but it is if you are potentially infected, you don't give it to anyone else. That is very important. So if you follow these four things, probably you should be doing your duty as a responsible citizen of India, and you will be prevented from getting this disease.
After today's deliberations, I'm sure our students will make sure that they follow these guidelines. Speaking of lockdown, Dr. Pankaj, let's see the other side of the coin. Do you think lockdown was a psychologically good decision?
Okay. This is a very interesting question, and it's found to be more energetic because it's out of the way little way. If you think what happened in our society just 2 months back, we are not following the rules. We are not with the families. We are more running towards the money, and we are not equating the relationship with our children, and we don't know how this is math subject is going on of my child, and anyone else don't bother about the many other things. We are more of a materialistic. If you talk about all this coronavirus infections and the fear of coronavirus land up into a lockdown, and that lockdown led up to many things. One is a good diet. A good diet is help for good immunity, and also is a good diet is helping for the increased level of thinking and increased cognitive profile. Second, the sparing the time for the children and the children's activity, the watching the children is growing up in front of you with the more times and having a plenty of a positive energy source around you will give you immense immunity boosters to fight with these things. Third thing is we able to identify our own inner side energies. Like if somebody is maybe more better cook than other ones, and normally some more poetic, more as musicians, which is inside of our heart. It's never been a time to become it out to show it to the other friends and other localities, and we able to understand the relationship more better, okay, which is now a need, not the money is actual one. So overall, if we see the both the prospects of the lockdown, it is being positive in other way around, and a negative. Definitely, economy is going down, and that will land up into a problem later on. That's a partner.
Okay, now that the lockdown is going to be over, Dr. Tarun, I would like to ask you that many students are apprehensive that how do we go to the college? Like which mask do we wear and how do we manage our masks? How do we go about our lives?
I'm very glad you asked this question because this is something very, very dear to me. And I am seeing a lot of people who are wearing masks, but they don't know how to wear them. So I'm very happy you asked them because, see, we have been told to wear a mask, but no one has really told us how to wear a mask. So, in fact, I took the liberty, I thought you would ask me, so I took the liberty of getting the masks which are available so that I can tell you which masks for all of you to wear. See, basically, there are three masks which are available at present. The first one, as we all know, is this is called N95 mask. This is probably the best, but this is meant only for health professionals. I'll give you the reason why. And then there's a surgical mask which is widely available. Many of you must be having this. This is a surgical mask, uh, and the third mask is the cloth mask. A cloth mask, you're all aware, and so practically for general public, you want to use a cloth mask is good enough. But if you're more you careful, then you can wear a surgical mask because this has slightly better efficacy. But N95 is not for general public. The reason for this is N95 is meant for health professionals because they are in close contact with uh, infected patients and they need to have a very good mask. But in average general public, if he or she maintains social distancing, would not need an N95 mask. For them, an N9 for a cloth mask or a surgical mask is good enough. And then you ask another question, how to use it. This is something very close to me because I feel people don't know how to wear this mask. So there are few things I would like to tell you what to do. See, when you wear a surgical mask or a cloth mask, the first thing you should see is whether it is torn or there's a hole in it or it is damp. If it is so, please don't use that mask. Second, whenever you have to wear a mask, what you should do is uh, hold it from the sides like I am holding. In this case, there's an elastic cord, so you can hold it from there. But if you have a cloth mask, in that case, you'll have cord, so you just hold it. Don't hold it from the front or from the back. Why? Because when you hold it from there, you're going to infect the surface. And when you put it on your face, the infected thing may go into your mouth and then into your lungs. And so remember, whenever you're going to wear a mask, you must wash your hands with soap and water and only then touch the mask. And then when you wear a mask, see what you should do is you should wear it properly like this. And it should properly cover your nose, it should properly cover your chin. But I see various styles which you must be seeing also. First is people keep the mask like this. This is absolutely useless. Why? Because you're not covering your nose, so the organism is going to go there. Second style, which I commonly see, is people wearing masks like this. This again is useless because your mouth and nose is uncovered. And third style, they keep it like this. No. So if you want to wear a mask, you should always wear a mask when it's properly covering your nose and mouth. And other thing I want to emphasize at this stage is when you're wearing a mask, you might feel itchy, you might feel you have sweat on your face, you want to touch that face. Don't do that because then you're going to again transmit infection to your face, which is not right. So if you have to do it, then you must wash your hands and then only touch your mask. And after that, once you finish using the mask, you just take it off again from the holding from this. Don't touch the center of this and just keep it down. And remember, I've also noticed people just take off the mask and keep it on their beds or on their tables. No, this is not right because you're transmitting the infection from the mask to the bed and the table. So what you should do is you should take it off. And if it is a reusable mask, then you can wash it and keep it in a separate enclosure. Or if you have a mask like this, then you should properly dispose it. You should put it in a plastic, either in a newspaper or a envelope, hold it, and then throw it in your dustbin. These are few things which I really wanted to specify, and I'm so very happy you asked me this question.
Thank you, Dr. Tarun. In fact, I remember a line from your video in which you had said that masks can be your best friend or your worst enemy. If you don't wear them well, they can be your worst enemy. Indeed, I'm very sure students will be very careful while wearing and handling their masks. Now, Dr. Pankaj, if you could please tell us about the fact that this lockdown period, is it associated with mobile addiction or corona fear? Like, what is it associated more with?
There's a few things which we understand. First of all, is addiction. Addiction means there is a strong craving for that particular things, and if that is withdrawn, we have some psychological issue with that to withdraw that sport, and gradually the time period of using that particular things is being gradually increasing day by day. Fifth effect of that is called as tolerance, and if the previous one is a withdrawal. And last but not least, it is a preoccupations. Preoccupation as psychologically is mean we have to think about that particular thing, see what is going to be next in this. And most of the web series, they have something in the something there in the end of the is a little climate of one episode that will lead to increase the endogenous hormones to see the next show how it will be going to act. And gradually, if we see one of us must be see everyone must be see this series web series today's world, and at the end of last 3 4 minutes they're given a very crucial risk to release that particular things and be able to see it. If we able to fulfilling these three, four criteria initially, we are likely to be into addictions. And one, second, the child is unable to leave that particular gadgets, either say iPad, MacBook, or a computer or a mobile, which is the most usable nowadays. Parents what usually do, what they will do? Let's play with the mobile only. And gradually, the only thing is I'm worried about is a more adolescence comes to me with their relationship disorders during this time because they have a plenty of times to interact and they are not able to manage that time how to interact, and there are many previous events comes out to be which make them vulnerable to have a more psychological problems. Overall, this lockdown period gives us a bad one that is adherence with the mobile and adherence with the internet, or obviously it's leading to internet addiction. And internet addiction I'm not talking about because it's a media by which we are interacting with one or others, and it may be helpful many of the things like schools using Zooms for educating the child at home, and invariably they are now eased to the person which whom to you see and whom not to see, and more vulnerability to having this interacting with to the others part. So addiction is common nowadays, and addiction is being transmitted one things to the others. And as the society change, we think about this: we are not addicting or not. If out of four, three are you having, there must be a chances to have addiction of a mobile or internet addictions.
Well said, Dr. Pankaj. If I may reiterate the words of our principal ma'am in her message just now, she has said social distancing now, and next we should be like prepared for screen distancing. So, students, while we live indoors, isolated in virtual realities, we should not fall prey to digital addiction. So, this is one message from Dr. Pankaj, which you should remember as you go home today. Dr. Tarun, I come to something that affects us all, the children, the adults, the elderly, everyone. Can we order food from outside? क्या पिज्जा order करना safe है? Please tell us. We are dying to know.
Yeah, it affects me also. I miss my sandwiches from outside. But see that you actually there are no known cases of person contracting disease from foodstuffs because the basic mode of this disease, getting this disease, is the respiratory droplets. But see, there are some theoretical risks when you order a pizza from outside. The person who comes to give you may be infected, and if you then don't take proper precautions, you may get it from him. Then there's a theoretical possibility, again very less. Someone with this infection has coughed and sneezed on your cardboard box of the delivery, and you touch that, you touch your face, you can get infected. Now, these two risks are very rare, but there is a theoretical risk. So, personally speaking, though, I would ask, I would want to order food, but I am not ordering food at our home for last few months, and I would not order for another 1 month for simple reason we are still not sure how this virus spreads. So there is always a little theoretical risk which I would like to avoid, and so I would probably try to cook at home if possible. But if you have to order, then take the due precautions when you take the delivery, and then discard the outer coverage properly, and then probably reheat the food properly. Your chances of getting it is very less, but no, maybe for a month, avoid it. Anyway, outside food is not good for our health. So if you can avoid it for a month or two, it will be good.
So, okay, avoid it for the moment and hone your MasterChef skills. Learn and make new recipes at home. Okay, we'll do that.
Yeah.
And talking of diet, we have a very interesting question from Ayushi. क्या कोई मल्टीविटामिन है जो हमारी इम्यूनिटी को इम्प्रूव कर सकता है?
That's for me?
Yeah,
Can I take
Dr.
it?
Tarun. Yeah, Dr. Tarun.
Well, see, unfortunately, there is no multivitamin we can take which is going to protect us from COVID. But I have another multivitamin which I tell all my patients. It has to be adopted and not ignored. What I mean by this is a healthy lifestyle. Healthy lifestyle is much better than any multivitamin. And by this, if you have good eating habits, take a lot of fruits, a lot of vegetables, rest properly, take at least 7 to 8 hours of sleep, exercise for half an hour a day, be positive, leave stress, and then lastly but not least, believe in God. I think that is the biggest multivitamin I can prescribe at this stage. And if you do that, I'm sure you will not fall sick. That's all I can say.
Thank you. You've given us a lot to think about. So, Dr. Pankaj, continuing with the same query, is there something like psychological immunity?
Yeah, there is definitely a link of immunity with the psychological issues. Psychologically, invariably, as a medical terminology, gives us good social support, good psychological support gives us immunomodulators, act as immunomodulators, which help us to take proper food and everything. We are happy, we are taking the food in a good way. If we are not happy, we are taking it lightly and we are thinking about more of a problem rather than a food. On the contrary, on the other part, if we are aware about okay, what is a there is a one term called a psychoimmunity. If we are strong enough, we are taking mentally, physically health well, and the sound mind will definitely help us to come out of this problem. So the childhood line is very simple. The sound mind is lives in a sound body. So physically fit means the physical immunity, the food intake, good food intake will help us to immune. If we have a good thinking, a good thought, that will land up into more immunomodulators and help us to fight more problem with this. If we go to corona, there's nothing in. If we see the data, there's only 2.8% of population who are affected by coronavirus is having a serious illness. So out of 100 is only maximum 3% having of symptoms or symptom enough to be in a hospital. Or out of that is only 50% of land up having a problem of breathlessness. If keeping in this view, 97% part of the population who is affected of coronavirus is abnormal, not having a symptom properly or having a symptom that is very low threshold is not causing any things to our body. This is more dangerous to having those who have a medical problem. So if we are psychologically up, if we are psychologically towards more of a fighting natures, then we are able to cope up this problem.
Oh, that is good. This is one positive fact to boost our psychoimmunity. And Dr. Tarun, I have one question from Mrs. Sabina. She's our IQAC co-coordinator and also the head of the Department of English. She wants to know that how can we safeguard asthmatic patients during the present scenario?
See, basically, you have to understand asthmatics have a poor lung function as compared to normal. So, the first thing is you have to be more than careful than other people. So, follow all the precautions what I said. And another thing you must keep in mind, you must keep your asthma well controlled. So, if anyone has asthma, he or she should talk to his or her doctor so that he can prescribe the necessary medicines so that you don't have a worsening of asthma. This is the asthma season. So if you don't have worsening, chances are you'll come out of a COVID infection if unfortunately you get it. So very important, follow all the precautions and keep your asthma under control. You should probably do fine.
That is really good. And Dr. Pankaj, there is a query for you also. She asked that how can we maintain a happy emotional state in such gloomy times? If you could just tell us.
More or less, we are not lonely at present moment. We are into a lockdown period where the family is with us, and children are more happy. They know that okay, who is what my parents is so much of a joyous nature I earlier have or not, and that see if is a elderly person at our home or children below 10 years at our home, it is itself is a immunomodulator because we are more caring towards the elderly populations, so we're taking more precaution towards that. We are more loving towards the children, so we taking care of extra precautions to get the things in a proper way. So overall scenario is different. The point of concern concern over here is how to approach that things. So in psychology, it's very one good thing is everything having something is a positive. Either is if something is bad happened to the society, there is always a positive one. If a psychologist, as a psychologist, able to see that many good things happen around us. Even I know come my this whole lane who is living in that lane and how their natures are, and I'm good about it now. If I'm going to walk in the street, then everybody come to know that this is Dr. Pankaj now, and I know that this is this and he's this. This increased relationship with the surrounding, which we have forgotten many a times, कि साडे गवांढ च कौन हैगा, and ਸਾਨੂੰ ਪੂਰੀ ਵਰਲਡ ਦਾ ਪਤਾ ਹੈਗਾ ਕਿ ਮੈਂ USA 'ਚ ਮੇਰਾ ਦੋਸਤ ਕੀ ਕਰ ਰਿਹਾ ਹੈਗਾ. So this is now a little change in the society. We able to recognize that what is neighborhood and what is our own parents mean and what is our relative means. This is one good thing, ma'am, about this.
That
And
is really
second,
good. And in fact, yes, sir.
yes, ma'am. So
I would like to share that the time I have spent in my garden in the last like 2 months, I don't think I have ever done it except when I was little and I used to be there when my parents were there. That is all. So that is very well said and so true. And now, Dr. Tarun, we come to the most often asked query by parents in this webinar. They want to know, can we call our help back? क्या हम अपनी maid वापस बुला सकते हैं?
Well, this is a question my wife has also been asking me for last 2 months. But see, there are few problems with calling the maid. First problem, see, most of the maids, they go to different houses and then they come to you. And one basic problem is, as you all know, during this epidemic, we have realized people can be asymptomatic and even then they can spread the disease. So if you have a person who comes to your house from outside, there are chances he or she may infect you or one of your family members. So practically speaking, there is definitely a risk when you call maids home. Personally speaking, I would say keep off maids for a few months. I know my wife is going to be angry at this, but I have no option. But I personally think we should keep maids out because we don't know if they're getting infections, and it's not anybody's fault because they are moving out, and so you're unnecessarily exposing your family to a problem. So maybe for 2 months or so, till we know more about this epidemic and see whether numbers are increasing, we should preferably keep them out.
Okay, so it's not the maid which is a problem. It is the fact that she visits so many homes and works there, and then she might bring the virus from there. Okay, thank you.
No, maids
And
is not a
another,
problem. I have
sorry.
Can I just say something? Maids are not a problem. It's not their fault. Again,
Okay.
emphasis, not their fault. Even if we
But-
go out, we are also going to give it to someone else.
Mhm.
It's not that we also may give it to them. It's not that we are absolutely safe. So just remember, all of us. See, three of us are sitting here. All three of us are asymptomatic at present, but we may already have been exposed to this virus. So we don't know at this stage. So just maybe wait for a month or so.
Okay, so we are all ready to tighten our belts and keep on working at home. Another view from the parents' side, Dr. Pankaj, are the parents more fatigued during lockdown?
yeah, fatigue invariably psychologically means that we are unable to think properly after certain points, and we are not be rejuvenate our body at a certain time, and we are unable to focus. If we focus attentions and cognitive profile keep in a view of a lethargy or a fatigueness, the parents are feel that our voice is little louder than the earlier with the children or with the other partner of our house, but the bonding is much more strong. So that leading to invariably the lead to decreased fatigue by this means. And definitely, if the domestic help is not here, the maid is not with the we all are working at our same corner. But on the contrary, both the partners are lives in the same house. So they are available now for each and every work. After that, many of patients, I'm interacting with the patients, how you feel with this lockdown. Approximately, if I see this as a scenario, I will see that everybody is happy with these things. We know that which corner is having this thing and which corner is not. Mostly husband don't know which where the things have been keeping up. And these things is been now able to understand. As Dr. Stija already been very defensive about keeping a maid in the house during this lockdown, it's more of uh, help definitely. And we don't know that what type of they interacting with the what type of a population outside of this house. So this is definitely a danger to the that particular loved one to how to control it. And second is uh, fatigue will come if the diet is not proper. So during lockdown, the diet is very much okay, and rather we miss the pizza, but we able to know that ye kharbuja bhi char tarah da hunda. So it's we'll able to understand now. So I think fatigue is not a part in this lockdown.
Chalo, that is a good thing that we have come to know. But parents are complaining. Like there are many queries in which parents have asked that our children are awake throughout the night, and if we ask them, they just say that we have slept during the day. We have our 6 hours sleep during the day. So is it okay? They say.
Yeah, this is what we talked about earlier. This is addictions. This is the dangers what we are spotting of. The lack of sleep, the what we call the change of a sleep cycle, will decrease the immunity by 50%, decrease the cognitive profile by 50%. We are not okay with the things this. Or lockdown period will persistent the cognitive part more deliberately. And second, if the children are more awakening during night times, the parents will not able to see the what happening to the web web things. The web is full of knowledge and full of shitty things also. We we are not able to concentrate. We are not able to see eye on our children to what are they are watching and what they are not. So this is a little dangerous to our society. I'm not against this, but I am want this should be deal with this. How do we deal with the sleep issue cycle is very different, very simple. For next 3 4 days, let's wake up at 7:30, irrespective of the sleep induction time or the time of when we slept. It's not bothered. Either it's 2 p.m., 2 a.m., 1 a.m., 4 a.m. But we have to wake up 7 a.m. And after that, we will not sleep for next. This cycle will repeat. Even third day, we will able to see that our sleep pattern will from 10 to 5 or 10 to 6, which is adequate time. I think Dr. Stija will agree with me. If more than 7 hours of a sleep in a day will help us to give us a good immunity physically, and physically we are more active if we are taking to the care. Sleep wake cycle will different, and that will lead to melatonin hormones will be a shivering, and that leading to a same place where the immunity part being gone off. So we have to take number one. Number two, taking of a food which would more have a tryptophan leading to more of a hormone related sleep related hormones like melatonin, like banana. Take a banana in the evenings will help us to sleep. Earlier we knew that ke parents ਸਾਨੂੰ ਦੁੱਧ ਦੇ ਸੀ ਸੌਣ ਤੋਂ ਪਹਿਲਾਂ, which is a good habit. And increase of our sprouts during the daytime. Badam is very helping to give us and undoubtedly as a college life everybody taking up for Rajma Chawal and have a good nap. And definitely Rajma Chawal have a tryptophan which leading to a melatonin secretions and leading to a sleep.
Thank you, Dr. Saab. I'm sure children can do this as or adopt this as an interesting experiment, waking up at 7, regardless of when you have slept, eating bananas, almonds, and your favorite Rajma Chawal. Just try it and you will definitely benefit from it. And Dr. Tarun, there have been many queries from our students who want to know that if I have cough and cold, what do I do?
See, technically, all coughs and colds are not COVID-19. You must realize that. We are right now in midst of harvesting season. We just finished, and we've had fields which have been burned, though not to the extent which we've been experiencing before. So a lot of people who have allergic symptoms, they will also have cough and cold. So if you have cough and cold, don't panic. Wait for a day, and then maybe the best thing would be to talk to your doctor. He would take the final call whether you have symptoms which are suggestive of COVID-19 or it is just an ordinary cough and cold. So I think leave it to your doctor and let him decide. That's the best way. But remember, majority of you, if you have cough and cold, probably be allergic. But if you have, there's certain warning signs you must keep in mind. One, if you have fever, if your cough and cold is different from what you used to have before. And third, if you have breathlessness, you feel unduly fatigued or headache, in that case, definitely we need to work you up for COVID-19. Otherwise, maybe just talk to your doctor, he'll give you symptomatic therapy.
So thank you. We'll be careful, and we don't have to panic about anything. So if anyone can have cough and cold in this season, and in case you feel apprehensive, it's always good to talk to your doctor. And they also want to know that in case we have COVID, where can we get tested for COVID? COVID की testing कहाँ होती है? Ludhiana में.
See, at present, I think we're getting COVID testing done at civil hospital. There, I think it is free. Then they're just available at major hospitals like DMC, CMC, at Oswal, and even at Apollo. So that was previously Apollo, now Satguru. But I believe they charge you there. It's about 4,500. In civil hospital, it is free. But you will need a doctor's prescription. You cannot go there and ask for the test yourself.
Okay, so we should not unnecessarily just go and think that we have to be tested for COVID.
No, absolutely not. We should go to a doctor, let him decide whether you need testing or not.
Okay, thank you. And one question from Jessica. She says that is it safe to receive a package now that Amazon and all deliveries have opened up?
See, WHO says there's very little chance of getting infection from things which are ordered from outside. The reason for this is because this virus does not stay on surfaces for long. There are different estimates. We are still not very sure how long it stays, but mostly people believe that it might stay up to a day or two. So there is a theoretical risk, even though WHO says and CDC says there is probably little chance, but theoretical risk is there. So if you receive a package, what I would suggest is if it has non-perishable stuff in it, maybe you can keep it in one corner of a house for few days and then open it up later. And after touching this outer surface, please wash your hands with soap and water. Probably that should be good enough.
Okay, and Dr. Pankaj, there have been a few queries about loneliness, that if we are not going out with friends, we feel lonely. So what is your take on loneliness? How do we deal with it? And not only from the students, I think more from parents and grandparents, that more from grandparents probably, that they're feeling lonely in these times, though everyone is home.
And then everyone is home and feeling of loneliness. Loneliness means that we are unable to communicate with the persons which we desire for, and the inner thoughts means comes in an inner sides only, and not able to gives a stimulus to the others. If we call accordingly, then we have to see this. Loneliness may be a part of one psychological or psychiatric issue, one that's separate. If we loneliness during this period, when everyone is at home, or this may trigger one thing is why how much we are socialized and what sort of we are thinking of. If you are more socialized persons, we are dealing with many of our NGOs earlier on, and we are not able to do that particular work. That is definitely affected. But during the lockdown period, the loneliness is little less with the parents. Parents are more feel happy, and the grandparents are more feel happy because everybody is at home. Earlier, the grandparents feel that they see the children only for a few hours only, 1 or maximum 2 hours, because they are all busy in their life, the fast going life, I would say. Now they are at home and they able to communicate. If the parents, the spouse or other person at the family is not communicating with the parents, that's a bad thing, and that should be keep in mind that why this relation is not healthy. The healthy relationship build up with only with the communications, and I don't think this should be a statement that loneliness is there now. If it is loneliness, then must talk with the psychologist, and this is the time to communicate better.
Okay, so this is also a time to introspect then, and definitely if you have an issue, you can always talk to an expert about it. And of course, there are people, Dr. Tarun, they still want to ask that now that lockdown is opening up, can we go out with friends?
Well, unfortunately, I would suggest not to take it slightly easy for next few months, because when you go out, one, probably the social distancing will not be maintained, and then obviously uh, when you go out in the market again, it's going to be a problem. So maybe take it easy for a month or so. Try to interact with them on social media. We have video conferencing now. We have phones which are available. So use these medias rather than meet them physically. I think that would probably be safer for you, at least for 2 months, because I feel now since lockdown is going to has opened up, we probably might have increased number of cases. I really hope not, but if we do, then it might be a problem. So take it easy.
So now that, this is exactly the second question, that if the lockdown is opening up, is the corona going to spread? Do we really have to worry and not go out?
Should I take that?
That's for you, Dr. Tarun. Haan.
Well, see, definitely, I feel the number of cases will rise because up till now we were at home, and this coronavirus, it needs a host to go up and then spread further. And since we were all in lockdown, people were inside their houses and they were relatively protected from this virus. Now, when we meet people, there are chances we are going to spread and we are going to get this virus. So the numbers are definitely going to increase. We should not uh, be unduly worried about that unless the numbers increase very high. Because I get a lot of patients who are worried the number has increased 7,000 today, 7,000 for last 2 3 days. Originally, they were only 2 to 3,000. This was to be expected. One, because we are meeting more people. Secondly, I think we are testing more. So I think we have to keep that in mind before really worrying about it.
There are some students who have asked that if is vitamin C effective to avoid corona?
See, vitamin C, you want to take it? Okay, vitamin C is effective in preventing coughs and colds. That most of us believe and are really think so. So, but unfortunately, in COVID-19, we don't have any proof that is really effective. But I feel there is no harm in taking vitamin C food like citrus fruits, like you have broccoli, you have potatoes, you have tomatoes, pepper. Because anyway, if you have to include them in a healthy diet, so if you do that, you are improving your health anyway, and plus you get your daily dose of vitamin C. Even if it is not effective, I think there is no harm in taking them. But taking it as in a tablet form, it's a you can take it, it doesn't harm you, but whether it's really going to help you, I am not very sure. And neither is anyone in the world of this. I think Dr.
So
Pankaj wants to say something about vitamin C.
No, no. So, vitamin D C
he
is an antioxidant, and I am agree with you, sir.
he'll talk about the happy hormone. And Dr. Saab, we also want to know that in your clinical practice, like, have you seen some typical mental health problems which have increased and which
Yeah,
you can see
definitely.
more now?
Bilkul. This coronavirus is being affected during the time when the season is changing in the South Asian countries, like in India, the season is changes. Our psychiatric problem is usually increased when the change of season are there. Whenever there is a change of seasons, there's hormones imbalancings are there, and that leading to the problem of vulnerability or the propensity to increase that symptoms higher during this phase. We feel that those who having a depressive disorders, a breakout of outbreak is just a symptoms that land up into a problem because of fear. because of not able to have a proper money to buy the many of the things. And there are certain things which like everybody have their desire to have a good house, a car, or a normal daily life structures, by which they are virtue to taking a loan from the many of a bank, and they are not able to pay off now. So that invariably leading to the problem of is this pattern. If we think about we should how we behave in this pattern, then we think about how to take this as an initiative. And thinking in a one platform will lead to out of this problem easily.
So, in a way, if we are together, we can deal with any problem. So, lockdown is one period where we can help each other in their mental health issues. So, one last question, Dr. Pankaj. What is your take home message for the students today?
I will say that all students should keep in one mind that only one mind in our body, and mind is such a thing. It's controlling things. If we fear about a corona, we will lose ourselves. So first, be confident, have some social distancing, love from heart, not from the voice or from the face, and live your life as you want, and take a proper diet. That's from my side.
Wonderful. And Dr. Tarun, the take home message from you, sir.
See, I personally feel we should not panic about this disease. Like I said before, we probably should overcome this disease, and by this time this epidemic ends, we should come out completely healthy. And there's one thing which I always point out to my patients. This virus has a lot of ego. It will not come to your house unless you really invite it in. Meaning, you will not get infected unless you are careless. So, if you follow the things which I said before, and like Dr. Pankaj said, have a healthy lifestyle, I think we should be able to conquer this, and hopefully, we should see happier times and be able to interact with friends, relatives as we were doing before.
Thank you so much. That is indeed a lot of food for thought. Our list of questions is seemingly infinite, but due to paucity of time, we had to limit to these. But KCW Counseling Cell has also provided a special link on the college website for COVID related information. It is called hashtag happy to help at KCW. So you are all welcome to go there and find out more about this thing. We also manage a Facebook page in collaboration with Dr. Tarun. It is called Wellness with Dr. Tarun Satija. You can refer to this page for mental health and physical well-being queries. Write to us for any additional information and we'll give it to you on this page. Moreover, if you have any issue and you want to discuss with us, please do mail us at unwindkcw@gmail.com. We'll be very happy to answer your queries. Now I invite Dr. Parminder Kaur, Head Department of Computer Science, for the vote of thanks. Dr. Parminder is not audible, I think.
Good evening, everyone. Concluding the webinar, first and foremost, I, on behalf of the principal ma'am, faculty members, and students of Khalsa College for Women, Civil Lines, Ludhiana, would like to express my sincerest gratitude to our esteemed resource persons, Dr. Pankaj Kumar and Dr. Tarun Sateja, for sparing their valuable time to apprise us all with their insights into how we can effectively deal with the current situation of uncertainty, anxiety, and insecurity created due to the COVID-19 pandemic. Your thoughts, words of wisdom, and expert advice have enlightened the minds and shown us a new path on how to better deal with the current circumstances. I'm sure that today's webinar will help our audience to reconnect to the present moment, interrupt our worries and worst case scenarios running through our minds, and make us all feel more comfortable, more safe, more in control of our lives, and more confident to face the future. To sum up, become our own warriors, as Dr. Aditi rightly said. Thank you, sir. Thank you so much. I also thank Madam Principal for her support, motivation, and latitude in organizing this event. And I finally thank all the participants, the students, and the honorable parents for joining us and participating in this webinar. We appreciate your involvement and thank you for sparing your valuable time. We end with prayers to the Almighty for an early end to the current turbulent times that we all are facing and to keep you all blessed and safe. Thank you, one and all.
Thank you.
Thank you.